Yes, GARFIELD-AF is a worldwide registry, and it is running over several years with cohorts every year, about 10,000 patients. And in the analysis that we are presenting here at the Congress, we looked at 28,000 patients and followed them for 2 years. So first of all, I'd like to credit the people who run this registry. It's coming out of TRI, Thrombosis Research Institute in London. And the cohort that we looked at was sampled from 2010-2014, and as I said, followed for 2 years. And we stratified these patients according to the type of AF, that is either paroxysmal or permanent or persistent or permanent AF. The first question we asked was, how did the therapeutic approach look according to this type of AF? And maybe not really surprising, it turned out that the paroxysmal atrial fibrillation population had much less of relevant therapy of anticoagulation for stroke prevention, for example, therapy, as compared to the more permanent types of atrial fibrillation. The most important finding of our analysis was the stroke rate and the mortality. So when we looked at the stroke rate and we corrected for differences between the population such as age, and actually we also corrected for differences in therapy, it turned out that the stroke rate was exactly the same in paroxysmal versus the more permanent forms of atrial fibrillation. And that tells us that the guidelines are actually right. The necessity of doing a stroke prevention in atrial fibrillation by anticoagulants is extremely important in paroxysmal atrial fibrillation patients as it is in permanent. However, as we now know from this registry and from other real-world scenarios, it is not implemented as much in paroxysmal patients. So that is an important learning from this analysis.